go. And so this announcement comes almost a month earlier than we all anticipated. And we're really excited to open eligibility to everyone in our community. And while we're opening up eligibility to everyone, this does help remove some barriers, but we know that there's still work to be done getting vaccines to our most vulnerable communities and encouraging people to get the vaccine. And Milwaukee County will continue to work with our community partners to address racial equity and work to close disparities that we're seeing, particularly in our Black and Brown communities. But I am encouraged by the numbers that we're seeing through the zip code program at Milwaukee County's Kosciuszko Community Center vaccination site. Last week, we expanded our capacity from 1,900 appointments per week to 2,500 per week. And since then, we have seen more than 80% increase in bookings, with the total number of doses administered to date reaching more than 7,400 folks, 7,400 doses. So last week alone, almost 2,000 people received vaccines at the Kosciuszko Community Center. And the top zip codes served continue to be the 53204 and the 53215 zip codes on the south side of the city of Milwaukee, and the 53233 in the central Milwaukee. And we also are seeing important increases, particularly in the 53209 and 53223 zip codes, which is representing the northeastern part of the city, as well as Glendale and Brown Deer. But the Milwaukee County Office of Emergency Management has received the Johnson & Johnson vaccine as well, and will be available starting tomorrow. So this means that Milwaukee County will not only administer the Johnson & Johnson, but also the Moderna vaccine at the Kosciuszko Community Center. So for anyone who hasn't received their vaccine, I want to encourage you to do so as quickly as possible. And if you need to schedule an appointment, you can visit covidmke.com to schedule an appointment. And there are appointments available tomorrow, and residents can check daily as more appointments open up. So when it's your turn to get the vaccine, I hope you choose to get vaccinated. And if you have questions about the vaccines, I encourage you to talk to your healthcare provider, your friends, your family, your faith leaders, your neighbors, and hear about their own experience, because it's important to know the facts. Just last week, I got my first dose, and I didn't have any side effects except for a sore arm. And, I got the shot to protect my family, to protect my loved ones in the community at large. And when you think about, with many children right now on spring break this week, and with the upcoming religious holidays, I want to remind people to practice physical distancing and wearing a mask. And if you can, participate in activities outside rather than inside. But along with getting the vaccine, these are some of the best tools that we have to protect ourselves and our community as a whole. And Easter is a time of hope. And as more vaccines become available, I'm becoming more hopeful. But we're also seeing cases steadily increase locally as well as nationally. And we can't give up right now. And so I want to encourage everyone to continue practicing the 3 W's as safety measures, particularly during this upcoming holidays. And I want to acknowledge those who are going to be celebrating the life of Cesar Chavez on his birthday tomorrow, March 31st. And for those who don't know, Cesar was an American labor leader, community organizer, a businessman, a Latino American civil rights activist. And his work lives on in those who continue to fight for racial equity, especially those in the Latinx community. So let's celebrate his life by honoring and protecting the community that he fought for, as we continue to address the 2 public health crises that we're in, as we talk about structural racism and the COVID-19 pandemic. And lastly, I want to remind everyone that next week, Tuesday, is April 6th. It is the spring election, and it is imperative that we exercise our right to vote, not only at the national level, but on a local one as well. And so next week's election will include voting on like the state superintendent of public instructions, local judges, and or school board members, depending on where you live. But keeping in mind that the safety precautions due to COVID, if you choose to vote in person, please remember to bring your mask, practice physical distancing, and wash and sanitize your hands when you can. And you can visit myvote.wi.gov to find your voting location and view who will be on the ballot. Again, that's myvote.wi.gov. And with that, I'd like to hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First, to our numbers, we are currently seeing an average of 112 new cases a day and about 2 deaths every 3 days. We're seeing a more definitive increase in cases in the county this week. So on Tuesday of last week, I reported 77 cases per day, and we're now at 112. That's more than a 45% increase in new daily cases in just 1 week. Meanwhile, our positivity continues to rise as our testing numbers do as well, indicating more individuals with close contact or symptoms in our community. And these elevated positivity rates are distributed throughout the county. They're in the far north, the south, the east, the west, throughout the county. And our county, our state, and many other states are beginning to see increases in cases as well. And this is due to a loosening of precautions paired with the contagiousness of the new variants. Now, at the same time, as we recently heard, Wisconsin is opening up eligibility to anyone age 16 and older to get the vaccine starting on Monday. And this is a major step for our state. Many more people will now have access to the vaccine. However, that also means that starting Monday, for at least the foreseeable future, there will be much more competition to get the vaccine. So for those who are currently eligible and have been on the fence about getting vaccinated or have wanted to allow others who may be at higher risk to go first, now is your time to get vaccinated before the door opens wider on Monday. So if you're in one of the 10 highly vulnerable zip codes, please get vaccinated now. If you have a health condition, please get vaccinated now. And if you are 65 and older, please get vaccinated now. There are nearly 40,000 individuals aged 65 and older in Milwaukee County that have not yet received a dose of the COVID vaccine. So if you're one of those people, you are in such a high-risk group with the increase in cases and particularly with the new variants that we are seeing. So please get vaccinated. The number of cases that we're seeing, coupled with the knowledge that the variants are widely circulating, leads to more, and that the variant leads to more severe illness, means that now it is more important than ever to be protected. Our site at Kosciuszko Community Center has appointments for vaccination tomorrow, as does the Wisconsin Center. And our site at Kosci Park filled up quickly initially, but now with our supply of Johnson & Johnson, as well as added scheduling capacity, we're opening up new next day appointments every single day. As state eligibility expands, we are working to continue to prioritize the most vulnerable members of our community for vaccine. So while we're certainly enthusiastic about opening up eligibility and getting more of our community vaccinated, we want to continue to prioritize those most at risk and most vulnerable. Please visit covidmke.com for our county site, or go to healthymke.com to see all the sites available to you, with appointments again as soon as tomorrow. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. As Dr. Weston mentioned, the COVID-19 case numbers are headed in the wrong direction. This is a troubling development with significant consequences. As our case numbers continue to increase, we'll see more people facing serious medical consequences and, sadly, more COVID deaths in Milwaukee. We are seeing COVID variants here that are spread more easily, and that could be a factor. Precautions are essential, so it's very important that everyone wear a mask when you're outside of your home. In fact, the ordinance requiring masks in Milwaukee is still in place. Keep your distance at least 6 feet away from others whenever you're away from your home, and please stay away from groups of people. And finally, wash your hands. Our public health orders and the restrictions that are in place are determined by our gating criteria. An important number that we continue to watch is the rate of COVID-19 cases in the city. Unless there are changes, the health department will be issuing a new order in the coming weeks, reimposing restrictions that were eased just a week and a half ago. This has implications for our entertainment, restaurants, museums, and bars. The only way for us to avoid new restrictions is for our case numbers to reverse and begin to decline again. Thousands of people have chosen to receive their COVID vaccine at our community sites. 10.4% of Milwaukee residents have received both of their doses, and 21% have received, at a minimum, their first dose. At North Division and South Division high schools, we've vaccinated more than 4,700 people in the last 6 days. In the Amani and Metcalf Park neighborhoods, Northwestern Mutual Foundation is supporting vaccination clinics. Tomorrow, one of those clinics will be open at the Wisconsin Black Historical Society from 9 a.m. until 1 p.m. It's located at 2626 West Center Street. Our collaborative efforts are starting to make progress in addressing these vaccination disparities, but we still have a long way to go to fully bridge that gap. The numbers of our Black and Latinx residents who have been vaccinated does not come close to the rate of our white residents. We're partnering with many community groups and churches, healthcare providers and pharmacies, and the county as a vital partner to address this disparity. And together we are working to maximize access and acceptance of the vaccine. The next couple of months are an important time in this course of the pandemic. We need to keep our efforts focused and energized so that we minimize the disruption and danger from COVID-19. Spring break is upon us, and so is the holiday weekend. This is no time to let our guard down. We must stay vigilant, washing our hands, wearing our masks, staying 6 feet away from others, and avoiding large gatherings. The weather in Milwaukee on Sunday is supposed to be beautiful. So if you're planning a visit with your family, please consider doing so outdoors where you can safely distance from one another, and please continue to wear a mask. Thank you.
Thank you, Commissioner. That is it for our speakers, so we'll move into the media Q&A for today. Our first question comes from Brett Lemoyne with Fox 6. He says, the Wisconsin Supreme Court is set to rule on the statewide mask mandate tomorrow. Is there a concern among health officials this will lead to an increase in cases? What, if any, impact would not having a statewide mandate in place have on the city of Milwaukee and Milwaukee County?
I can speak to the city of Milwaukee. Dr. West and I are looking at each other. I can speak to the city of Milwaukee. Our city mask ordinance still stands and will remain standing. However, it will have an impact on the community surrounding us, and I am concerned about a further increase in the number of cases.
And I would just add to that, we know that there are key precautions to take to prevent an oncoming spike of cases. And one of those is getting vaccinated. And the other one is the same simple precautions that we've been talking about for nearly a year now, which is chief of which is wearing a mask.
Our next question is from Chuck Kornbach with WWM, and it's for Commissioner Johnson or Dr. Weston. Any second thoughts about having 11,000 fans at American Family Field later this week? Why or why not?
So I can speak to that. The size of the gathering does give me pause, but I am confident with the Brewers safety plan in place. They've done an exceptional job of assuring that groups will be socially distanced, or physically distanced. There will not be interaction between groups. People there are very strict protocols in place to assure that interaction is limited between fans that aren't there together, and there's plenty of space for everyone who'll be in attendance.
Our next question is from Mike Spalding with WTMJ 620 AM radio, and it's for Commissioner Johnson. The governor said vaccine eligibility will open to everyone 16 and older on Monday. Are you confident the health department will be able to handle a spike in vaccine appointments, and how will the Milwaukee Health Department go about doing this?
Yes, I am confident we will be able to handle this. We've been planning for it for a few weeks. We have available appointments right now for tomorrow and Friday, so I would encourage people to go and register for appointments at the Wisconsin Center. But we are planning to have additional appointments available starting on Monday, and we feel confident that we'll be able to address this.
Our next question is from Ben Wagner with WISN 12. He says, the Brazilian variant of the virus was recently found in Ozaukee County. Are there any concerns that variant is spreading locally, and are we testing enough for these variants at the state level, given they have been shown to spread faster?
So certainly the Brazilian variant is of concern. When we saw the UK variant, the B117 variant, that seems to be the most widespread right now, certainly in the United States, we know that one is more contagious and appears to be more severe. The Brazilian variant adds to that it appears to have some degree of immune system evasion as well, certainly for natural infection, maybe not as much for vaccinated individuals. They still appear to have high levels of protection, but not as much for people who've been naturally infected before. So absolutely, anytime we're seeing a new variant, particularly one of the variants that we've seen cause so much damage in Brazil and other countries where it's become dominant, it's of great concern.
And Ben has a follow-up to that. He says, Michigan health officials recently said they are in the midst of a third wave of infections. With the increase in cases here, do you believe we could be at the start of another wave of infections here?
There are a number of warning signs that we're seeing in Milwaukee County and in the state. The fact that we increased our new daily cases by over 45% in a single week, the fact that our percent positivity is increasing, the fact that our testing rates are increasing, which we want people to get tested, but it's just another indicator that there may be a higher burden of disease in our community. And now we're seeing state numbers start to turn. So certainly Michigan is in very difficult times right now in their case burden as well as their hospitalization burden, which is especially concerning as more and more people are getting vaccinated. They still have a high hospital burden, potentially from the increased severity of the strains. So there are warning signs that we're seeing right now. And that's why getting vaccinated and continuing to take precautions for the time being is what's so important.
Brittany Lewis with CBS 58 is asking Commissioner Johnson, when will the Northwest Health Center be operating as a vaccine site for those in the zip code program?
Absolutely. It is Monday. Sorry, I have to look at a calendar. Monday, April 19th, it will open.
Our next question is for Commissioner Johnson, so you can stay on. It's from Sarah Lesk with the Milwaukee Business Journal. She says, based on the gating criteria and trends, when do you anticipate making a decision about whether to stay with the current order or make some changes? Could you be a little more specific than in the coming weeks?
Within the next 2 weeks, we anticipate that we will be addressing the gating criteria and potentially issuing new orders.
And additional questions from Siri are local vaccinators prepared based on current infrastructure and vaccine supply for the change in eligibility next week?
I can really only speak to being prepared at the City of Milwaukee and the Milwaukee Health Department sites, and we are prepared and anticipate an increased demand, but we do have the vaccine and we'll have more starting next week.
All right, the next question is from Taylor Lumpkin with TMJ4 for the county executive. She says, shifting gears for a second, next week, beer gardens in Milwaukee County are set to start opening. How big of an economic impact do these establishments have on the county?
Well, particularly in the middle of a pandemic is one of the very few ways that we have to generate revenues through our park department. But we also want to make sure that we can continue to provide a level of quality living for all of our Milwaukee County residents. So we are excited, and hopefully we'll see a lot more of our residents utilizing our county parks this summer.
Our next question is from Megan Hart with the Wisconsin Public Radio. She says, could you please provide an update on efforts to vaccinate homebound people, and could homebound people make up a significant portion of the 40,000 people over 65 who haven't been vaccinated?
Yeah, so we do have some homebound vaccinations ongoing currently. In Milwaukee County, we are looking to expand that substantially in the near future. The Milwaukee County Office of Emergency Management is working with the Milwaukee Health Department, other local health departments, as well as service programs such as Meals on Wheels to identify vulnerable homebound individuals as we plan to begin vaccinating them and expanding that capacity in the very near future. But certainly a portion of that 40,000 individuals, I don't think a substantial portion, but certainly a portion of them probably fall into that category. So it's a critical group to target.
We have two questions from Allison Durr with the Milwaukee Journal Sentinel. I'll start with the first one. For Commissioner Johnson, what status is the gating criteria, or what status in the gating criteria would prompt you to reimpose restrictions? Will the restrictions that had been in place before the current order just be reinstated, or will there be changes from the previous restrictions?
Sure. So we are looking at all of the gating criteria, so the number of cases and the testing specifically, and we know both of those are rising. And the number of cases, so our burden per 100,000 is actually already in the higher category, and testing is making its way in that direction. There is an interim order or restrictions that we jumped over from the last order, so it's likely we would move back to that interim order. And that information should be on our website. Yeah.
And the second question was, when will the city's website be updated to allow all those 16 and older to sign up for appointments?
Over this weekend, it will be opened up for next week.
Fabulous. Sari Lesk with the Milwaukee Business Journal has follow-up questions. She says, past comments from the department have indicated compliance checks are either complaint-driven or when you are spot checking. You're looking only at those without a safety plan. If you don't have a specific complaint about a business with a safety plan, how do you ensure the restaurant, bar, or event venue is following the plan and mitigating risk?
So compliance checks are primarily complaint driven, but there are spot checks. The spot checks are not limited to the restaurants or businesses or events that have safety plans. Spot check can happen at any time.
The final question I'm seeing in the chat is from Brittany Lewis with CBS 58. She says, last week, Mayor Barrett said the capacity at North and South Division high schools was greater than the demand for the vaccine through the zip code program. Is that still the case? What is being done to get more people to those locations?
So there has been a significant push in those communities in terms of communicating via social media and boots on the ground, partnering with our community partners to drive more people to those locations. Interestingly, South Division, we've had more people there than we have at North Division. So again, we're really working to try to bring people in to get shots in arms.
And Allison Durr with the Milwaukee Journal Sentinel is wondering, how many first doses did the city and county receive this week, and how many are anticipated next week?
I don't think we're not provided data from the state of the exact allocation that the county gets, where there's many different vaccination sites throughout the county, and each receives different allocations. And unfortunately, that's not data that we have to share.
And same from the city.
Chuck Kornbach with UWM is wondering, should the Brewers start a rewards program for fans who have been vaccinated?
So there have been lots of conversations around the value of a rewards program. I think there are still challenges in terms of sharing that information, and how do people share protected health information? How do we know that it's valid? So I know there are conversations happening both nationally and internationally in this space. So more to come.
And Sari Lesk with the Milwaukee Business Journal is clarifying a previous question. She says she meant past comments from the department have indicated spot checks were limited to those businesses without a safety plan. If you do not get a complaint about a business with a safety plan, how do you hold it to the terms of its plan?
So we are spot checking facilities that do have a safety plan. Again, our enforcement is really driven, the inspections are really driven by complaints, but we do spot checking periodically.
Excellent. I'll give it just a final minute to see if there's any additional questions for the chat. Okay, one more from Allison Durr with Milwaukee Journal Sentinel. She was asking specifically about the city and county government and how many doses were received.
Certainly I can get that information. I don't have it in front of me right now of exactly how much the county got, but we can get back to you with that information.
And the same, I can get the information.
Excellent, so we'll follow up. And Chuck Kornbach with WUWM is wondering, how many more people in Milwaukee County will be eligible under the state's new eligibility order?
It's a great question. It's one that's hard to determine because of the health conditions in particular. So we don't have exact data on how many people qualified or qualify currently based on health conditions or the other categories. But certainly one would expect this is hundreds of thousands of more individuals that would become eligible.
All right. Seeing those are all the questions. Thank you all for joining us today. Thank you, media, for all of the great questions. And we'll see you all on Thursday.
Thanks, everyone.
Thank you.
Thank you.